Thank you for stopping by to see Dr. Lapin's work. Although it is known that quality of life is maintained in ALS as disease progresses, a recent work examining factors affecting quality of life did not report an effect of disease duration on factor loadings. The objective of the study was to examine reprioritization of factors affecting health perception with advancing disease in ALS. This is a cross-sectional study performed during routine clinical care. Disease was staged by the FT9 staging, wherein stages 0 to 2 were early stage and 3 and 4 were late stage. Various self-report measures were collected, and latent constructs of physical and psychological function were constructed. Structural equation modeling by group was used to examine changes in effect. 578 patients were included in the study, of whom 155 were late stage. As expected, ALS-FRS-R was lower, as was quality of life in late stage disease, whereas PHQ-9 was higher. For early and late stage disease, correlations between patient-reported outcomes are reported here. The measurement models used for latent constructs are presented here. These are structural equation models we constructed. The outcome of interest is the VAS, which is at the top. Factors loading on it are physical function, psychological function, and pain. As disease progresses, the effect of physical function declines, whereas the effect of psychological function increases, and the correlation between physical and psychological function disappears with disease advancement. Multiple factors modulate these effects. Of interest, longer time from diagnosis was associated with better psychological function in early stage disease. Our findings suggest reprioritization of health perception with advancing disease in ALS, with a greater loading of psychological well-being, a reduced loading of physical well-being, and an uncoupling of psychological and physical function. This study raises questions and opens opportunities. Are self-regulatory models more efficient in ALS, perhaps because of frontotemporal dysfunction? Is there time dependence of adaptation? Is it more efficient or more complete with longer duration of disease? Because psychological functioning has a greater effect on health perception and is uncoupled from physical function, and also may be amenable to treatment, we should expend greater resources on psychological well-being to improve overall quality of life in ALS. Thank you.